And just try to stay around here because I have the virtual guys listening too.
Okay.
So they can't hear you if you walk all the way down that way.
All right. Good morning. My name is H1 Hickman. I'm a IDC with Bravo Company here at Portsmouth. I work at the Family Medicine Clinic. I've been in the Navy just a little over 10 years. Before being an IDC, I was at First MLG with John Louis, and before that, I was at Naval Hospital Lemoore. So, spent most of my career in California, and this is my first time on the East Coast. Quick little, I guess, ground rules. Obviously, food, snacks, fine. In the event of an active shooter, we're gonna run hide, fight in that order. All right, we're gonna try and barricade the doors. In the event of a fire, we're gonna exit out, muster up in the parking lot, and then we'll take roll and kind of go from there. Okay. Any questions before we start? All right. So starting off with preventive medicine and infection control. This isn't the P5010 part, right? But it's in the Corpsman manual, so there's more so wave tops. But just going over basic sanitation and things like that. All right. Sanitation is the hygienic means of promoting health through prevention of human contact with hazards of waste. As the corpsman, the medical department representative performs sanitation inspections and provides recommendations to the CO. A vector is any animal capable of transmitting pathogens or producing human or animal discomfort or injury. Pests are organisms that adversely affect military operations and the well-being of a man or animal, and attack real property, supplies, and equipment. Foodborne illnesses represent a threat to the health and morale of military personnel. When assigned as a MDR, corpsmen may be given the responsibility of inspecting food service facilities, and investigating foodborne illness outbreaks. Navy and Marine Corps food service facilities are required to be inspected by an MDR together with the food service manager, officer, or a designated representative. Findings of inspection are reported on the NAVMed form 6240/1. All right, you guys have been in for a while. You guys are HM3s going up onto HM2, right? You guys all know if it's a slant, it's a form, right? If it's a tap, it's an instruction number. It's very important, especially shipboard life, for anybody who has been on a ship before. Very close proximity, right? Not a whole lot of space. That's why it's very important for you as corpsmen to not just be clean yourselves, but also make sure you guys are policing the people around you, all right? When I was in 29 Palms, we had a corpsman who was not very clean. He was eating in his rack, and we had a rat infestation. And so things like pests, rats, bugs, roaches, things like that are all very attracted to food and scents, stinky smells and things like that. And so not just not eating in your berthing, but also keeping things tidy can kind of help mitigate those risks, okay? All right, some more terms: prophylactic immunizations. Vaccines used to protect Navy and Marine Corps personnel against certain diseases before exposure to infection, right? That's that prophylactic part, before exposure. Susceptible host: diseases that may be transmitted from a carrier to a susceptible host. Transmitted directly from an infected person or animal, or indirectly through an intermediate host, vector, or inanimate object. And infectious agents, they cause illness by invading and multiplying in the host or from release of toxin. All right. Some more terms. All right. Asepsis. So A, your prefix, sepsis, right? Without sepsis. State of being free of pathogenic organisms, an aseptic technique. Any search text? No search text. All right. They practice aseptic technique all the time, right? So there's a particular order you're supposed to don and doff all your PPE, and that mitigates the risk of any kind of cross-contamination and stuff like that, right? Maybe not too important if you're just doing a quick physical exam. But if you're doing a minor procedure, especially as junior corpsman, I let my guys do minor procedures, sutures, toenail removals, and things like that. You want to lessen the chance of causing any kind of infection, right? All right, bioburden, the number of microorganisms contaminating an object, known as bioload or microbial load. Bloodborne pathogens, a pathogen that's bloodborne, right? So pathogenic microorganisms that are present in human blood and capable of causing disease in humans. Bowie-Dick type test, a diagnostic test of a pre-vacuum sterilizer's ability to remove air from the chamber and detect air leaks. This is not a sterility assurance test. So it's just more so making sure that there isn't any compromise, right? Chemical disinfection, the destruction or inhibition of most viruses and bacteria while in their active growth phase. Does not necessarily kill all spores, nor can it be verified by a monitor. Chemical indicators, chemical dyes used to determine whether the conditions required for sterilization are met, known as internal or external indicators, dosage indicator, and process indicator. For those indicators, you'll like in your peel packs, sometimes it'll be like just like a little dye in there that show you if it might have been exposed to anything. All right, any questions?
I wouldn't worry about most of these right now because I'm going to go into detail more when we hit chapter 10 over the actual sterilization chapter, so you kind of understand each of those terms. This is just a very broad overview with this chapter.
All right, contaminated, the presence or reasonably expected presence of blood or other potentially infectious materials on an item or surface. Contaminated laundry, laundry that has been visibly soiled with blood or other potentially infectious materials. Culture, the reproduction of and growth of microorganisms in living tissue cells or on a nutrient medium. Dental item classification, dental items are classified as critical, semi-critical, or non-critical based on the pathways through which cross-contamination may occur and the location and technique of the instrument used. Critical items, instruments and materials that penetrate the skin, mucous membranes, or bones. These items must be sterile before use. Examples include surgical instruments, periodontal knives, and suture needles. Semi-critical items, instruments, equipment, or material that frequently contact mucous membranes that cannot be sterilized because of their design or inability to withstand heat. At minimum, these items require high-level disinfection. Examples include some radiographic positioning devices and plastic impression trays. And non-critical items, your instruments, equipment, or materials that do not normally penetrate or contact mucous membranes, but which are exposed to splatters, sprays, or splashing of blood, or are touched by contaminated hands. These require intermediate level disinfection, and these include dental unit or a medical exam. All right, still more terms. All right, to cleanse something, disinfect it. To cleanse something so as to destroy or prevent the growth of disease carrying microorganisms. Infectious agent. An infectious agent is an organism that is capable of producing an infection or infectious disease. Infectious microorganism, organism capable of producing disease in a host. Invasive procedure, a surgical entry into the tissues, cavities, organs, or repair of major traumatic injuries. This includes the manipulation, cutting, or removal of any oral or perioral tissue during which bleeding occurs or the potential for bleeding. Microorganisms include bacteria, fungi, viruses, and bacterial spores. A nosocomial infection is an infection resulting from treatment in a hospital and is secondary to the patient's original condition. It is unrelated to the primary diagnosis.
I may know the hours for a nosocomial infection.
72 hours.
Yep.
That one I've seen a few times.
And they actually, what's funny is this is one that contradicts himself because one instruction says 48 to 72, and then another instruction says 72. So just know again what it's talking about in the question and know which instruction it's referencing.
All right. And PPE. We all know what PPE is, right? Specialized barrier, attire worn by an employee to protect against a hazard. Good Lord. We got a lot of terms here. All right. Occupational exposure, reasonably anticipated skin, eye, mucous membrane, or parenteral exposure to blood or other potentially infectious materials that may result from performance of duties despite the appropriate use of PPE. Saturated steam sterilization. This is a process that uses steam heat under pressure for a sufficient length of time to kill all forms of microorganisms. Sanitary sewer system is a sewer system connected to the sewage treatment plant. And spray, wipe, spray, an acceptable method of cleaning and disinfecting. Presently, there is no agent on the market with the Environmental Protection Agency registration that cleans and disinfects in one step. The importance of cleaning as a separate step from disinfection and sterilization cannot be overemphasized.
Remember, this core manual was made way back when. We now have that agent, which is called what? Cavi wipes. So again, don't mix up what we do in real time now. Part of the manual that was written back in the early 2000, it was 2010, 2012, one of those time frames. We didn't have one, and now Cavi wipes is the thing that can clean and disinfect.
All right, sterile field, a specified area, such as within a tray or on a sterile towel, which is considered free of microorganisms. Sterile or sterility, free from all living microorganisms. Sterilization, process that destroys all types and forms of microorganisms. And sterilization area, the area of a healthcare facility designed for housing sterilization equipment and conducting sterilization procedures. Any questions so far? Sterilizer, gravity displacement type. This is a type of sterilizer in which incoming steam displaces via gravity the residual air through a port or drain, usually in or near the bottom of the sterilizer chamber. Sterilizer pre-vacuum type is a type of sterilizer that relies on one or more pressure and vacuum evolutions at the beginning or the end of the cycle. Unit dose, the quantity of materials or supplies required to treat a single patient. Standard precautions is a protocol for infection control that treats all human blood and bodily fluids is known to be infectious for human immunodeficiency virus, hepatitis B virus, and other bloodborne pathogens. So we're just assuming that no matter what, that patient, right, until it's just better to be safe than sorry. Engineered controls, method of managing environment and health by placing a barrier between the contamination and the rest of the site, thus limiting exposure pathways. And work practice controls, controls that reduce the likelihood of exposure by altering the way one performs a task, such as having a patient brush their teeth or using antiseptic mouthwash before beginning a procedure. Using the rubber dam whenever possible, disinfecting the isolated teeth, and using a disinfectant mouthwash before and after applying the dam. Heavy duty puncture, resistant utility gloves are used when handling instruments and while cleaning and disinfecting instruments during the sterilization process. Using an accepted and safe technique for recapping needles and disposing of sharps before beginning cleanup procedures at the conclusion of treatment.
Since it mentions this, I want to mention it there because it's been a test question. It'll say that you need to mouthwash before for each patient for a dental procedure, and it's going to talk about the microbial count. It brings it down 97% for mouthwash. Okay, don't get that confused with hand sanitizer that kills 99%. Mouthwash is going to kill 97%.
Any questions so far? All right, we're finally done with terms. All right, so classifications of microorganisms. You have bacteria, viruses, protozoa, and fungi. Bacteria in a spore state remain alive but passive. Passive meaning it's not causing any disease, right? Resistant to effects of heat and drying and most bactericidal chemicals. So in a spore state, they're a lot more resistant, whereas when they're in their cellular state, right, they're susceptible to bactericidal chemicals. Viruses are microorganisms. They're much smaller than bacteria. Viruses cannot live long or reproduce outside of the host. They're broken up into 3 categories. So you have bacterial viruses, animal viruses, and plant viruses. And most viruses are susceptible to immersion in boiling water for at least 20 minutes.
There's that point I made earlier for your difference, right? See that key word? Cannot live long or reproduce outside the host is your viruses, right? I'm going to tell you that because knowing these two and how to differentiate them will make a lot of sense going through every one of your diseases and why some of them are more dangerous than others, especially in your biological warfare agents, and obviously all your PrevMed chapters.
Yep. And the viruses require a host to reproduce, right? Bacteria don't need a host to reproduce. Protozoa are single-celled animals that do not have a rigid cell wall, pathogenic, and they survive freely in nature, and most are spread by a carrier. So those are like your brain-eating amoebas. All right, and fungi, plants that lack chlorophyll, free-living organisms that are smaller than protozoa, for example, mold and yeast.
Chlorophyll, more like borophyll.
All right, standard precautions. Standard precautions are intended to reproduce the transmission of microorganisms from recognized and unrecognized sources of infection. Universal precautions is a subset of standard precautions focusing on infection control methods to prevent spread of disease from blood and bodily fluids from direct contact by utilizing PPE. All right, so you have your standard precautions and your universal precautions, right? And then hand washing is one of the most important procedures in preventing the transfer of microorganisms from one person to another. Hand washing must be completed at the beginning of each day, before and after each patient contact, before handling food and medications, after causing, sneezing, or nose blowing, after using the toilet, in contact with blood, bodily fluids, secretions, excretions, and contaminated items, between patients, and at the end of the day.
What was the time frame for your washing of your hands?
15 seconds.
15 seconds.
Yep. There's your test question.
All right. 2 types of skin harbors: resident flora and transient flora. Resident meaning it's on your hands, survive and multiply on the skin, can be repeatedly cultured from the skin, and of low virulence and not easily removed. Transient, do not survive and will not multiply on the skin, not firmly attached to the skin, and effectively removed by rubbing hands together. 2 main hand washing agents are water-based and waterless. Water-based include chlorhexidine, alcohol, and iodophores. Chlorhexidine is an approved surgical scrub, and iodophores are water-soluble and effective agents against gram-positive and gram-negative bacteria, as well as viruses. Waterless agents contain 70% isopropyl alcohol and disinfect the skin in 20 seconds. Effective against bacilli, fungi, and viruses. And they should only be used when hands are not visibly soiled.
Visibly soiled is always going to be the term you see to let you know that you're going to be washing your hands with soap and water compared to using this waterless antiseptic.
Maintenance for refillable hand washing agent dispensers is to empty, disassemble, and clean them weekly. Right? And PPE. Washing increases the protective nature of the gloves up to 60%. Repeated use of a single pair of gloves is not permitted. All gloves are single use, right? So don't use them with multiple patients. Don't take them off and then put them back on. It's just gross. All right, and different types of gloves. So you have your sterile surgical gloves. These are high quality, most expensive and used for surgical invasive procedures. They're also sized too, so if you don't know your surgical glove size.
I think they wrote this down wrong on the slide, but it's not the protective nature, it's the porosity. So saying you have like wet hands, and you haven't completely dried them and you put on gloves, it's gonna make that material, that glove, more susceptible to possible punctures and everything else. So it increases the porosity of those gloves up to 60%.
Undergloves are worn underneath the primary surgical gloves, called double gloving, which is standard practice in most surgical areas. Procedural non-sterile offer the highest quality and best fit at a reduced cost. Latex examination, probably the one you guys are all most familiar with. Least expensive, non-sterile, well, excuse me, not latex, nitrile, sorry. We don't really use latex anymore. Least expensive, non-sterile, commonly used in routine procedures. That's not true, so disregard that. Unless you see it on the test, right? So, like H1 said, the questions were written and the Corpsman manual was written a very long time ago, and a lot of things have changed. So nitrile can be sterile or unsterile, and they're made of synthetic latex. Contain no latex proteins, which reduce possibility of any hypersensitivities. Excellent resistant to punctures and tears, and 3 times more puncture resistant than rubber. Right. So the nitrile is going to be the most common one you guys are using. All right. Continuing on, long sleeve gowns are required with procedures involving exposure to blood or other potentially infectious materials. Clinic apparel can only be worn in the treatment facility. Clinic apparel has to be changed daily or when visibly soiled. Do not leave dirty linen in lockers overnight. Do not take clinic attire home to avoid the spread of pathogens. So if you guys work in a clinic where you guys are wearing scrubs, make sure you guys are changing them out often. Don't take them home overnight. Don't leave them in your locker overnight. It's kind of nasty. Wear a face mask and shield and change out after each patient or when visibly soiled. Dealing with lab or equipment repair, when you're sorting laundry, and then also during decontamination procedures. Surgical masks are made from paper or non-woven material that's worn during surgery. Cone masks, stiff, thin, woven masks used for simple procedures. And then the one you're all probably familiar with the last few years, the N95 respirator. Lightweight nose and mouth respirator, and is used during surgery or during airborne precautions. So does anybody work in like the ICU or anything like that? Anybody ever worked in the ICU? Okay. Do you ever have to do like droplet protocol or positive pressure rooms and stuff like that? So in primary care, probably not your biggest focus, right? But if you guys are ever in ICU, NICU, things like that, you guys got to take this stuff very serious, because not only can you get it, you can get it and then pass it on to other people.
It's also used all the time in dental because we're dealing with aerosols the entire time.
Yep. Eyewear must have solid side shields for protection. All dental patients require eyewear. Headwear must be worn during surgical procedures. Cloth scrub may be worn, but must be washed daily. Right.
Don't be a gross guy and use the same scrubs all week. Don't do it. Also, why you should also wear a jacket around your scrubs every time you leave an operatory or room, because anything that's on you, you can now contaminate anybody else.
All right. Transmission-based precautions. Any questions? Still good? All right. All right, airborne precautions occur by evaporation of droplets that remain in the air for long periods or spread by dust particles containing the infectious agent. Place patient in a negative pressure room with air being pumped outside. All medical personnel must wear OSHA specified N95 masks and place surgical mask over patient nose and mouth during transport. All right.
Again, to reemphasize what I talked about yesterday, what is a negative pressure room? Yes, it's going to keep the contaminants in the room. So in this situation, we want to keep that patient with the contaminants all secured in that location so it's not exiting anywhere else.
All right. And droplet precautions used for patients infected with microorganisms spread by coughing, sneezing, or talking. Patients shouldn't be placed in a private room or with another patient with the same infection. There should be a 3-foot partition between the two patients. All healthcare providers should wear masks within 3 feet of the patient and place a surgical mask over the patient nose and mouth during transport. Contact precautions should be used for patients infected with organisms that can be transmitted by direct contact with the provider or indirect contact with patient care equipment or surfaces. Patients should be placed in a private room or with another patient with the same infection. Gloves must be worn upon entering and changed after handling infectious material. Ensure to avoid touching face. Disposable gowns are worn. Transport patients only if necessary. Patient care equipment is dedicated to single patient to prevent cross-contamination. All right, immunization and testing. All personnel providing direct patient care who are potentially exposed to blood and saliva must receive hepatitis B vaccine. All active duty healthcare personnel will be tested for HIV every 2 years and TB testing or screening on an annual basis. All right, so the TB testing is a little bit more flexible now. If you answer no to any of the screening questions, you guys aren't required to do the PVD screen. But if you've had any contact with refugees, if you've worked in close contact with inmates, things like that, then homeless population, refugees, and things like that, then at that point it would probably be more beneficial. But whoever's doing the screener would catch that.
Just because I like to reemphasize everything, what is the form that we're using right here for your annual basis? Which one? /8. 6224/8.
All right. Infection control in treatment rooms. Medical asepsis. Practices used to prevent transfer of pathogenic organisms from person to person, place to place, or person to place. Reservoir, the carrier of on which the infectious agent primarily depends for survival. Portal of exit, avenue by which the infectious agent leaves its reservoir. Mode of transmission, mechanism by which the infectious agent is transmitted from reservoir to susceptible host. Portal of entry, avenue by which infectious agents enter the susceptible host. And then the susceptible host is any living organism that afford an infectious agent nourishment or protection to survive and multiply. Concurrent disinfection, daily measures taken to control spread of pathogenic organisms, and terminal disinfection, measures taken to destroy pathogenic organisms remaining after patient discharge from isolation.
So I like to put it in a visual for the chain of infection. We'll take a mosquito, for example, right? So your reservoir is going to be the mosquito that is carrying the malaria. The portal of exit is going to be them biting you. Or is it bite? Yeah, it's biting you, right? That mode of transmission is going to be on the skin, into your bloodstream, right? That portal of entry is fully, so the mode of transmission will be a bite. portal of entry will be through the bloodstream, and then U is a susceptible host. So I know we hit this term earlier. Why do you think people in Europe were a susceptible host during the plague? What was the theme about Europeans back in that time frame? They were dirty, they didn't wash, so they were already a climate for to be attached to as a susceptible host to get those diseases, right? Reason why most of your other third world countries are the ones that have all those diseases because they don't have the sanitary standards that we have here in the U.S. or have the ability to do so, right? So that susceptible host is somebody that makes them more apt to getting malaria. So that's why we have prophylaxis and get those immunizations and everything else so that we don't become a susceptible host for that reservoir. Does that make sense?
Infection control in the DTR. So work surfaces, equipment, and other reusable items must be decontaminated with an EPA-registered disinfectant. At the beginning of each day, water line units should be flushed for at least 1 minute and then 30 seconds between patients. Potable water contains up to 100 CFU per milliliter, and water in dental units at times can contain in excess of 1 million.
All right, so remember how I said different manuals have different numbers? You got to pay attention. Does anybody remember how much the between patients was on the other manual? 20 to 30 seconds, right? You see how some of those sometimes contradict each other? And then you go over the CFUs. What's the big number we're looking for this colony units that was in the previous chapter? No more than how many? 500. No more than 500 colony forming units. I've never seen 1 million on the test. I'm telling you right now. It's usually going to be no more than 500 colony forming units.
Dental officer may direct patient to rinse with mouthwash before treatment. 3 10-second rinses temporarily reduces a patient's microbial count up to 97%.
That key thing I was going to tell you earlier. So say that one says 30 seconds, the other one says 20 to 30. I would go from the instruction that is the newest, right? The Cornell manual was updated forever ago. The manual I mentioned 20 to 30 seconds was in the 6220.9 Bravo, which literally just got updated a couple years ago when they combined the dental infection control and the other infection control instruction together. So for you, if I were me, they're going to go for that newest standard, which is the 20 to 30 seconds.
It is mandatory to use the unit dose concept when dispensing supplies for each treatment setup. Corpsmen must never use their hands to dispense items from bulk storage containers. And before leaving DTR, all personnel will remove masks and gloves except when transporting contaminated instruments to CSR. Any questions?
And those are the type of questions that you were talking about might throw out of a test. It could be ones like that where they have multiple answers because they're mentioned in multiple instructions.
DTR's dental treatment room, right?
Yes.
Okay. Obviously, these slides are kind of more so catered to dental treatment, but it still applies to primary care clinics, your specialty clinics, anytime you're doing any kind of minor procedures, or if you're a surg tech working in surgery, right? All right. So continuing off the last slide, patient contact areas and any other used equipment shall be wiped down between every patient. The disinfection method used is the spray, wipe, spray method. Mops should be used with a detergent and an EPA-registered disinfectant, or detergent with bleach in a 1 to 100 dilution. Mops must be cleaned once every 24 hours. Flush the HVE system with at least 1 quart of water. Clean the system with HVE at least once a week. Corpsmen should never lay contaminated instruments directly on countertops. And instruments are either transported to CSR wrapped and covered with the original wrap or in a leak-proof covered container. Each unit water line and hose is flushed for 30 seconds. Handpiece maintenance after each patient requires lubricating it and operating it for 30 seconds. All right, a lot of times. Everybody good? All right, exposure incident. So in the event of an exposure, let's say you're for whatever reason working in dental and helping your hygienist clean somebody's teeth and your patient bites your finger or something. Stop activity immediately, step away from the area of contamination, squeeze skin around needle stick to expel blood and contaminants, cleanse the puncture site or flush eye with cool water for 15 minutes, report incident and seek medical attention promptly, and follow facility's protocol for follow-up. Especially if a needle stick is involved, the baseline blood draw will come from the patient and injured caregiver, and periodic blood samples are drawn over 12 months to determine health status and the need for treatment. So when I was a young corpsman working on the MSW floor, one of the nurses was putting in an IV, and I was assisting, but not directly assisting. But when she got the IV in and advanced the catheter, she wasn't able to get the hub onto the IV catheter completely. And so instead of getting gloves and then helping, I just went to help her. I got some blood on my hands, and I had to go to Occ Health, and they had to draw blood. It wasn't even a finger stick or anything, but that's how serious they take this, right? Because this is something that can affect you for the rest of your life, and it can shorten your lifespan too, right? So it's not anything that you want to take a chance to. So always make sure you guys, as soon as you guys can, report that up to your superiors.
Because most blood diseases are going to be how they're going to present? Asymptomatic, right? So you're not going to catch them until you actually do lab tests later. Pay attention to the 15 minutes. That is the operation of your eye wash stations, which will be mentioned in other chapters. So just know for eye wash stations, that rule is going to be 15 minutes. And then don't assume anything with the needle sticks either. This is where I was talking about where it's good to do infection control as needed. I used to work in a clinic where dental was upstairs, medical was upstairs or downstairs. They didn't really talk with each other. I was the one running the sterile processing. Well, they did surgeries downstairs. One of the things they did is I went into the bucket, and one of these guys didn't remove the scalpel blade from the scalpel handle. And luckily, I was paying attention when I put my hand in the tank, but simple things like that can easily get you stuck or cut from something from procedure by simply just not removing a blade from a handle or making sure you're discarding of those needles. I locked my CSR after that, by the way. I wasn't letting anybody else in there but me.
All right, moving on to the management of infectious waste. So infectious waste, liquid or solid waste containing pathogens in sufficient numbers and sufficient virulence to cause infectious disease. Examples include sharps, such as needles and scalpel blades, microbiology waste, such as cultures, stock containing microbes, pathological waste, such as human tissue, body parts, liquid waste, blood or cerebrospinal fluid, and medical waste from any isolation room. Infectious waste shall be placed in containers labeled with the universal biohazard symbol and the word biohazard. Bags must never be overloaded and should be double bagged and secured. So double bagged, goosenecked, tied, secured with tape. And sharps are placed in a rigid, puncture-resistant red sharps container with biohazard symbol. Never clip, cut, or bend needles to overfill containers.
If you cannot lock that sharps container with a locking mechanism that is on there, that sharps container is too damn full. You know what I'm talking about? There's little plastic clips that clip in there when that thing is full for you to start sending off to where it needs to go.
Liquid waste will be poured into sanitary sewer systems through clinical sinks unless prohibited by local or state authorities. Alright. Management of infectious waste. Recapping may need to occur, especially in dental procedures with a second dose of anesthesia, and the technique used should be the scoop method.
One-handed scoop method.
Everybody knows that one. They still teach that in core school, I'm assuming. Alright. Contaminated laundry is any laundry soiled with blood or what is it, open? Open.
Other potentially infectious material.
And will be packed in a red biohazard container or bag labeled properly and should be handled with gloves. Do not store infectious waste without refrigeration for more than 7 days.
That is too broad of a topic. That is, do not store non-pathological waste for more than 7 days. Remember how we had the difference? Pathological was 24 hours, and then if it's frozen, 30 days, and then your non-pathological waste was 7 days.
Store waste at or near the transport site.
There's that gelatinization. I knew it was somewhere.
Alright. So, just your little chart for treatment and disposal methods for infectious waste. Microbiological waste requires steam sterilization, chemical disinfection, or incineration, and they should be disposed in a sanitary landfill.
This is why I hate some things that are referenced. A lot of this is already contradicted with your 6280.1 and your 6220.9 Bravo. So, to me, I'm still not going to study gelatinization because the newer instructions have it as steam sterilization or incineration.
Yeah, and then pathological is incineration.
So again, they're not going to count you against that because if it's contradicting information, those are the questions that they would throw out of the test.
Alright, we'll skip that one. Cleaning and sterility. At the end of each day, each operating room should be terminally cleaned using a antiseptic germicide solution. The use of mops in the operating room is the least desirable method of cleaning.
Test question.
Surgical aseptic technique is the term used to describe sterilization, storage, and handling of articles to keep them free of pathogenic organisms. Alright, to maintain aseptic technique, personnel having colds, sore throats, or open sores will not be permitted in the OR. Operating room attire must not be worn outside the OR suite. Surgical members having direct contact with the site must perform surgical hand scrub. Gowns worn by surgeons and scrub corpsmen are considered sterile from shoulder to waist, and ensure patient's skin is clean as possible before a surgical procedure. Unsterile articles must not come into contact with sterile articles. You always see, people who are gloving up for procedures, and they have their sterile gloves on, and they're like, I don't know what to do with my hands. Or it's because if you drop them below your waist, you are no longer sterile, right? So you'll see the surgeon getting his glove on, getting his gown up, and then he's like twisting around when they're wrapping him up in his little gown. That's why. Surgical hand scrub considerations. Nails should be no longer than the fingertips. Use approximately 6 milliliters of antiseptic detergent and running water, and lather hands 2 inches above the elbow.
2 inches above the elbow is a test question on there. They will talk about that.
Always keep the hands above the level of the elbows. From sterile container, take sterile brush and dispense 6 milliliters of detergent on brush and begin scrubbing hands and arms. Each surface area needs 20 strokes with the brush.
Seen that one on the test with the 20 strokes.
Do not rinse the arm when finished scrubbing one arm, only rinse the brush. Rinse both hands and arms, keeping hands above the level of elbows, allowing water to drain off the elbows. Dry the hands with a sterile towel. So, and gowning and gloving, excuse me.
Donning and doffing is technically the term for it.
Dry hands, pick up your gown, let the gown unfold, open to locate sleeve handles. I cannot read that word because it's way too blurry.
Basically, you put it on and somebody else ties it in the back for you. Sometimes they even put the mask on their face. If you've seen some of the Grey's Anatomy episodes, like they'll have somebody literally just putting that on there so they're not touching anything in that scenario.
All right, and gloves, right? So you're gonna open up your pack. You got your gloves out. Don't touch anything on the inside. You're gonna grab your first glove, the inside of the glove, and you're gonna put it onto your hand without pulling back, right? Then you're gonna take your sterile hand underneath the cuff of the other glove, and then you're gonna put that on, and then you can
Make sure you have the right size.
Yeah.
For somebody that has bigger hands, you need to order the right size for the sterile gloves because they're already a pain in the ass to put in. And if they're too small, you're basically going to ruin your aseptic technique while putting them on because they're not going to go on the way they should fully on your arm. So,
All right, that's everything. Any questions? That's very long.